Thank you very much. Thank you very much for attending, and I'd like to say thank you to the National Skills Academy for giving me the opportunity to stand up here and be very nervous for a half an hour. I'm looking forward to that immensely. This is probably the worst session of any conference. You've just had lunch. You've calmed down for a bit from a frantic morning. So just another little housekeeping rule. If you nod off, please be aware of the person next to you and try not to snore, because they might be the one person who wants to hear what I have to say. So just bear that in mind. Right. Let me kick off. Normally I have my 14-year-old daughter beside me when I'm dealing with this amount of technology. And she stands there and sighs, "Oh, Dad, you're useless." So I'm going to see how I manage it without a safety net. The session title is the greater recognition of the role of the registered manager, and I am going to, a little bit later on, link it in with dementia care. So what I'm going to cover in this is the introduction, the role of the Skills Academy around leadership, what we as an academy think leadership is, why we think leadership matters, especially right now, and how we can strengthen leadership, the practical steps. And I will spend some time talking about the leadership qualities framework in relation to registered managers. And registered managers covers those who work in care homes and those who work in home care. The important phrase in the work that's been done by the Skills Academy is, "And it all starts with me," which is very, very important. Just two quotes. "Social care lacks confidence. As a result, it is timid in its vision and ambition for how adult social care services can be delivered." And that's from Social Care Review by Dame Denise Platt in 2007. "And there is a unique culture within social care. Social care is often positioned in the shadows. This is disempowering and has the effect of reducing confidence and stifling innovation." That was feedback from Skills Academy consultation on the leadership strategy for adult social care. Coming out of the Social Care Review of last year, the Academy was asked to lead on work around leadership. Sorry, if you just bear with me for one moment. If you could do those last two quotes, if you could just hold on to those as we go through and think about what they say. The upshot of all the work that's been done on social care and all the work that's been done on leadership is that without good leadership, there is no good care. I'm a man now, I'm having problems multitasking. Just a little bit about the National Skills Academy for Social Care. It was established in 2009. It's employer-led. It focuses on leadership, management and commissioning in social care. And these are just some of the organisations who are members. And again, as I said earlier on, this phrase will keep recurring. Leadership starts with me. And this is what the Academy thinks leadership is. Leadership is not about what happens at the top of organisations. Leadership is what happens from the bottom up. It's one of the big pieces of work that the Academy has done is the leadership qualities framework. And this is how the Academy sees that it can help registered managers particularly to strengthen leadership. We're involved in a business of providing care where Our residents, or the people we provide care for, have a wide range of complex needs, be they physical, emotional, social, psychological. The Leadership Quality Framework is about the responsibility of all staff in demonstrating appropriate behaviours. It's about contributing to the leadership process, and it's about developing and empowering others to contribute to that process. The framework lends itself to care, where the tasks are more complex and highly interdependent. Sorry. These are the key leadership behaviours identified by people in social care. And the temptation looking at this slide is to say, we've been here before, we know this, so what are you going to do about it? The Leadership Quality Framework lists the behaviours which are most likely to achieve excellent leadership in adult social care. It gives substance to the notion that leadership can be displayed at all levels in adult social care. It supports the integration of care. It provides the evidence base and authority behind the National Skills Academy leadership programmes, and it also provides the evidence base and authority behind the improvement tools that go along with those programmes. This is why the Academy thinks that leadership matters at this point in time. We're currently faced with revenue challenges and funding pressures for employers. And for some, there is the issue of managing growth. There is the need to do more and more complex with less and less resources. There's a need to work with wider groups of stakeholders, CCGs, public health, personal budget holders, housing and planning. There is a need for adaptability and innovation, and this leads back to the second point, the need to do more. We're working with new client groups, we're providing flexible care models, and we have a growing band of self-funders. Of equal importance, and probably most importance here, is the need to revert to the old values and virtues. And part of the fallout from the Winterbourne View and Mid-Staffordshire issues is that we need to look at how we provide care with dignity and compassion. The crucial role of leadership is recognised across the sector in the policy context. Caring for the Future, Reforming Care and Support in July 2012 said, "The sector needs high-quality leadership at all levels. It is essential to the delivery of all proposals in this white paper." So that's how much the government, how much importance the government places on leadership. Who Cares was a practice-based survey undertaken by the Academy among leaders in social care. And out of that came 94% of respondents linked the quality of leadership with the quality of service, and 93% of respondents wanted more investment in leadership development. Anecdotal evidence says that the biggest variable in staff feeling empowered and engaged is the quality of leadership. And in the external environment, there's an unprecedented mix of circumstances: demand, supply, structural change, and cultural issues. This is the Leadership Qualities Framework, and it is a tool that, rather than being very theoretical, it is a tool that you can work with and is available from the National Skills Academy. It's an essential tool for small, medium and large employers to measure and strengthen leadership capacity. It's also for micro providers, user-led organisations, service users who commission services and personal employers. and it's for commissioners and regulators to use as a guide or a quality indicator. There is free online individual and organisational self-assessments based on the Leadership Qualities Framework. There's a 360 feedback and one-to-one organisational assessments mapped to the CQC essential standards. The leadership development programmes are mapped to the Leadership Qualities Framework for all levels and to support career development, succession, planning and talent spotting to help grow your own. There are links with CQC regulation and inspection. There are links with local authorities and other commissioners and other sectors. It is part of the support programme for registered managers, which I will come to in a moment. It has a values-based recruitment tool to be launched in June, based in scenarios. It's based around recruiting for values and training for skills. Now, I'm going to whiz through these slides because I want to get on to. There are examples of transforming the culture of social care through leadership. And this is around what's available for different levels of staff, for commissioners, for regulators. Sorry, just bear with me for 1 minute. Yes, an example of tailor-made programs. Sorry, I'm going to whiz on a couple of slides. Strengthening leadership in your organisation. Focus on behaviours and the use of coaching and reflective approaches. This is around the registered managers as a lead professionals, and this is how they're seen in the review of social care. Registered managers are seen as, if you like, a vital part in any change that's going to take place in social care. The concerns when the Academy looked at the role of the registered manager last year was that there was an increasing complexity in the role and there was frequent isolation. So the Academy developed a programme for the spring of 2013 that has been rolled out. There are also national networks which are now being set up, which the government, through the White Paper, has funded. There is a community of practice, free training events that have been rolled out by the Academy and others, and advice, guidance and support. Leadership can make a difference. It's for everyone, and there are practical ways to strengthen and embed it at minimal cost. Leadership is about behaviours. It's based around behaviours that demonstrate values and embed a culture of care. The Leadership Qualities Framework is out there and free of charge. Use the Leadership Qualities Framework as a benchmark and a guide in assessment, selection, supervision and appraisal. What, very briefly, I would like to do now is look at where it fits in with dementia and the registered manager. The current situation with dementia, and I'm very conscious that there are speakers coming behind me this afternoon who will know more about this, who will have forgotten more about this than I know. The government is eager for care homes to work together with the government in the rollout of the dementia strategy. In a recent YouGov poll, 30% of the public believe people with dementia are treated well. There are 70% who believe that they're not. Currently, there are around about the 700, depending on the statistics you believe, There are 700,000 people with dementia, which is, I think, is costing around 1.8 million. By 2038, and these are the statistics in the government strategy, both of those figures are expected to double. So the time is there now to deal with dementia and to provide an effective care and treatment for people with dementia. The Alzheimer's Society recently stated that 80% of care home residents have dementia or a severe memory problem. Less than half are enjoying good quality life. And there is an increased risk of hospitalization for those with dementia. Sorry, I'm just moving on again. So this is the Dementia Strategy. It was published in 2009, so we're quite a way in. It's a 5-year strategy. And there are 3 key steps: better knowledge, early diagnosis, and developing services. And they're further broken down in the strategy into 17 objectives. There is an opportunity for registered managers who are at the centre, who coordinate the care, be it in home care services or in homes, to be part of the rolling out of the dementia strategy and to play a significant and effective part in this. Providers, commissioners, regulators, health and social care professionals have unique skills and knowledge in the area. The success of the dementia strategy rests on the effective collaboration between the commissioners and the registered managers who provide the care. I would like to finish up by quoting from a piece in today's Guardian that I came across by accident. And it came from Dennis Goldberg, who was imprisoned with Nelson Mandela, and he was speaking today about leaving Nelson Mandela in peace to end his life. But he spoke about leadership, and he said new leaders must step up to the plate, and they've got to hit the home runs. That's what we need at every single level, not just the highest level. And I just thought it was very appropriate to what I was speaking about today. I think the dementia, the white paper generally, but the dementia strategy specifically, is not just an opportunity for registered managers to step up to the plate. It's actually a necessity and a duty for registered managers to step up to the plate and share what they know so that the dementia strategy is effective. Thank you very much.
Thank you, Jim. We've got plenty of time for questions, so thank you for that. Yes, we've got a lady in the middle. Anybody else?
Hi, I'm from Roland Residential. I'm a carer. I just have a question I was hoping you'd be able to help me with. Looking at the skills you put on about the leadership characteristics, it seems that you need those whether you're a carer, whether you're a banker, whether you're in government. They seem very broad. And I'm assuming that the leadership qualities framework has some sort of ranking for these skills. And I was wondering, how do you quantify skills like teamwork and being a people's person and things like that?
I think specific quantifying of leadership skills would be down to the organisation that you work for, because you know best what you do. And I'm just trying to find it, what the skills, what the National Skills Academy has done. No, it will come. There's this one here, and I don't know if you can see it, but these are the specific frameworks our set of skills for example, the operational leaders, commissioners, training providers, strategic leaders, frontline staff, frontline leaders, graduates and employers. And I would advise you to go onto the website and click on the one that most apply to you for the a more detailed answer to that.
Thank you.
Anybody else would like to ask a question? Yes, lady at the front, Hilary.
Hi, my name's Hilary Woodhead. I work for Dementia Pathfinders. I just wonder whether there was anything particular that you're developing around leadership that's specialist to the dementia care workforce, or whether you're linking with programs that are already in existence, because there are many very high quality leadership programs in dementia care that are in existence now. Is there any way that mapping's already taken place, that they already map to that your quality standards, or is that work in progress?
No, I think it runs alongside. The work that's been done around dementia has been done. It's been mapped out. Already we've got CCGs taken up the work with GPs. I know in Surrey they're working with GPs, and they're working on early detection. What the leadership quality framework serves to do is that actually these are behaviours that we know that if we exhibit these behaviours, we're going to be able to deliver good care, whether that's in dementia or it's in a hospital or it's in home care.
Okay, we have Helen Smith here from the National Skills Academy, wants to say a few words.
Hello there, sorry, just to help Jim out there, I'm a delegate here as it happens, and I'm working on a different programme, but just to add to that and to say that the Leadership Qualities Framework itself the idea behind it is really to set a foundation stone, to really have something that we can all look at to work towards. And the circle that we saw is then broken down into further levels, which says how does that interpret at the various levels of the sector in terms of what the behaviours that we might want to adopt to be able to really transform the sector by embedding leadership at all levels. In answer to your question, Hilary, we have actually taken early steps to become involved in looking at what we might want to provide as an offering around dementia. We've been working with ECHA specifically as part of the DH Working Party on dementia and the Dementia Challenge. And recently we developed a pilot programme for them and delivered that in quite an innovative way, actually, in the sense that we worked with one of the London boroughs, and we worked specifically with a commissioner. It was around commissioning dementia, and across a community. And we worked with the commissioner to really get together and help them in developing their own leadership skills, to get everybody involved in delivering dementia services within that London borough together to start to create an informal local network that could then start to put together an action plan, to start looking at what the key challenges were, think about how we can engage GPs and people from new partner areas, so new agencies that are moving into the mix as a result of integration. And that was something that came out. We got very, very positive feedback and results from that, and that London Borough is now moving forward with an action plan together, and we're still working with those commissioners to help them to develop the relationships, and also to engage with the providers as well, because of course providers drive so much innovation in an area, and actually the providers can help the commissioners a great deal as well. So it really is that's really the approach of the Academy. We've got offerings at all of those levels, so we're starting to develop programs. We've got a really successful program called Lead to Succeed, which is specifically for registered managers, and it really applies to lots of different settings. So the young lady that was asking the question about also the how we we can kind of like qualify or quantify around behaviours. That's also a piece of work that we're working on and doing some research into. It's a very, very interesting question. In sectors like law, for example, they're already, and in health as well to a certain extent, they're already far further ahead in kind of looking at how can we measure what a good behaviour looks like, and there are different scales of Likert scales and all sorts of different things. So at the moment, as we know, when we're looking at really qualifications and saying, okay, you know, these are the skills that you require, and they're quite sort of clear, and there's a kind of a tangible result at the end of it. We're busy on that, looking at how we might learn from other sectors in working out what those behaviours need to be, and ultimately, I mean, it would be wonderful if we were able in some way for behaviours to contribute to as evidence to qualifications going forward. But that's still something which, you know, we're interested in looking at, but is something that is still in its early stages. But if you have any thoughts on that and wanted to get in contact with me, please let me have your email address, and we can talk about that more. So I don't know if that just added a little bit more to Jim's points, who I'd like to thank very, very much for standing in for Terry Myers in her absence at such short notice.
Okay.